Afro-Latina Bobbi Fives, 17, has no prior history of mental or physical disorders. She recently complained to her family doctor about feeling unmotivated, losing her appetite, losing her energy, and having a depressed mood. In addition, her parents said that they've seen her withdraw from relatives and friends and stop playing basketball and theater. Although Bobbi had put on 11 pounds since her last physical and seemed unconcerned with personal hygiene, the history and physical revealed no noteworthy findings. While Bobbi claimed she didn't use drugs and wasn't suicidal, she seemed to be discussing a lot of passive death related issues during this talk. Continuing with the clinical history, Bobbi's parents looked to get along well and didn't seem worried about her sister, who is 7 years older than Bobbi. Last year, her sister went through a brief depressive episode that didn't require any further therapy. Her mother, who was now 39, had a history of severe depression that resulted in years of therapy and a course of antidepressants. In the last 15 years, according to the mother, there hasn't been any sign of depression. Bobbi's father, age 42, reported that he would occasionally feel down but never had the urge to see a counselor or take medication. Yet, after work, when he gets home, he does consume a few drinks. He says that drinking beer makes him feel calmer and puts him to sleep. Lastly, Bobbi has taken no medication and has talked with the school counselor on some occasions about her depression and declining performance in class. The counselor then referred her to the family physician for an extensive assessment and the name of a therapist in the area. To look further into Bobbi's depressed mood, she will be given the Beck's Depression Inventory. This inventory is a 21-item self-reporting questionnaire for evaluating the severity of depression in normal and psychiatric populations. The scores range from 0 to 63, 0 being minimal and 63 being extreme or severe. Here on this slide, you can see an example of the inventory and how to interpret the scores. As you can see, many of the questions are interpersonal. To review more of the questions, you can click the link that can be found in the references. Before diagnosing, we want to acknowledge some key symptoms that Bobbi has. Bobbi has expressed that she is unmotivated, has a loss of appetite, experiences fatigue, has difficulty sleeping, has gained weight, has difficulty concentrating, and have some isolative behavior.
On my first slide, I'm going to talk about is DMS-5 diagnosis, major depressive disorder, which is F32.1. It's going to be perceptively low, depressed mood, decreased interest, lack of energy, sleep disturbance, and suicidal thoughts. The next slide I'm going to talk about is DMS-5 diagnostic criteria. Diagnostic criteria. A. 5 or more of the following symptoms have been presented during the same 2-week period and represents a change from previous functioning. At least one of the symptoms is either 1. Depressed mood, or 2. Loss of interest or pleasures. So number 1, depressed mood most of the day, irritable mood in adolescence. 2. Marked diminished interest or pleasure in activities. 3. Weight loss / gain or increase / decrease in appetite. 4. Insomnia or hypersomnia. 5. Psychomotor or retardation. 6. Fatigue or loss of energy. 7. Feeling worthless. 8. Diminished ability to think or concentrate. And the last one, 9. Recurrent thoughts about death. So the next slide, part 2, is the same diagnostic criteria, but it breaks it down into B, C, D, and E. So B, symptom cause clinically significant distress or impairment in social, occupational, or important areas of functioning. C, the episode is not attractable to the physiologically effects of the substance or other medical conditions. D, at least one major depressive episode is not better explained by schizophrenia or other unspecified schizophrenia. And the last one, E, there has never been a mimic episode. For my next slide, I'm going to talk about the commonly known medication. Commonly known medication, SSRI. SSRI includes Selectrix, Lepacro, Paroxetine, Paralix, Zufult, Zibride. Sorry if I'm pronouncing them wrong. For my next slide, I'm going to talk about the commonly known therapies. So there's going to be psychotherapy and ECT therapy. So within psychotherapy, there's going to be CBT, which is cognitive behavior therapy and interpretational therapy. With ECT, which I cannot pronounce, is going to be suicidal, refusal to eat or drink, and psychosis. For my And for the treatment planning, me and my partner are going to split it up. So I'm going to talk about the medication and she's going to talk about the therapy. So for the medication, it's going to be 5 mg a day of Votroctin first 2 weeks. And the same thing again, but it's going to be 10 mg for the beginning of the third week.
To piggyback off Sarah, this medication was chosen due to its low potential for overdose, low level of sedation, and effectiveness in promoting sleep and enhancing cognition. While taking her medication, Bobbi will have individual counseling. She will be attending 3 sessions a week. During these sessions, the counselor will be able to keep a close eye on Bobbi for any changes in suicidal thoughts and actions.